Now, news from the UK, where it's a race to vaccinate people as the more infectious variant of coronavirus is spreading rapidly there. There are fears that health services could be overwhelmed. The government is also considering an even stricter lockdown measure. British authorities have had to set up temporary morgues in some areas outside after the local hospitals. Mortuaries have run out of space due to a surge in the deaths caused by the pandemic. Britain has reported record levels of deaths and new infections in the last few weeks, fueled by the new variant of coronavirus, which has caused a surge, especially in London and southeast England. Well, to talk more about this, we're joined by Professor Geoffrey L. Smith, Head Department of Pathology, University of Cambridge. Thank you so much for speaking to us, Professor. So in the UK, really, here in India, as we're waiting for the vaccination program to begin there in the UK, it's a race against the spread of the disease.
Yes, it is. And well, first, thanks to NDTV again for the kind invitation. I'm happy to be part of your program.
Thank you.
And you're right. Your introduction puts it correctly that it is very tough at the moment. We have large numbers of new infections still, and we have large numbers of deaths. But I think we're at about the worst that it's going to be, and things are going to get better. The vaccine is being, or vaccines are being rolled out. And estimates are up to a couple of 100,000 people per day will be immunized. And so over a period of time, we are going to build up protection in larger proportions of our population, and this will help to suppress the pandemic. But I agree with a lot of what your previous speaker had said. Very good advice that if you are offered the vaccine, then obviously one should take it. And I wouldn't worry too much about which vaccine it is. Or at least in the UK, there are now 3 that are licensed. They all have greater than 90% efficacy. And so if you get offered one, the advice would be to take it. Don't delay waiting for another one, because during the period of that delay, of course, you are still vulnerable and could contract the disease. And also, it's very important to continue to have public health control measures for everybody, including those who may have had the infection previously naturally or who have been vaccinated. As you heard a moment or two ago, it is still possible that people who have been infected or who have been vaccinated might acquire a low level of viral infection. They will not get disease, but they might have enough virus to possibly spread it. And so we need to maintain this social distancing of hand washing, face masks, and keeping 2 meters apart until this pandemic is really controlled.
Right. Now, this talk of, this new variant in the UK, which has really, crippled the situation there in terms of you've got a lockdown in place, health services are being overwhelmed. But now you have the South Africa variant, and the latest is this other variant from Brazil. How worried should we be about this? Because these are variants that have been detected. We don't know if perhaps there are many more variants around.
Well, there are many, many variants. I mean, as an example of that, when the virus first was imported into the United Kingdom in February and March last year, sequencing of the genomes of those first cases showed that there were more than 1,350 genetically distinct virus strains of SARS coronavirus 2 that were imported mostly from other European countries. So the idea that we just have one strain and we've got 1 or 2 or 3 new variants is the wrong message. There is genetic diversity amongst the pool of SARS coronavirus 2. And of course, most of those variants really have no change in their biology and therefore are not likely to spread more easily, are not likely to cause more disease, and are not likely to escape existing immunity or vaccination.
Right.
But, yeah, go ahead.
Yes, Professor Smith, also have you been seeing, the numbers here in India have been going steadily down. We've been recording below 20,000 cases every day, even as we've seen the cases exploding in the US and UK. What is your assessment of this?
Well, it's a reflection of how well the nation of India and the citizens of India are doing to control the epidemic by good public health measures of hand washing, face masks and social distancing. And I warmly congratulate you all on that and encourage you to continue to do the things that you're doing so well at the moment. And if you do that, you'll keep this under control until the vaccines have been rolled out sufficiently to control the epidemic in that way. And we should follow your example and do more rigorous social distancing in UK.
All right, that is something we've seen a lot of resistance to. There's also a bit of anger against the lockdown and now talk of an even more severe lockdown being put in place. But thank you so much, Professor Smith, for speaking to us here at NDTV.
Thank you.